Regular physical activity is just as effective at treating depression and anxiety as the best therapy techniques and the best medications that we have. Now, maybe you know that already. Obviously, the catch-22 here is that it's difficult to get most people to engage in regular physical activity, and obviously conditions like depression and anxiety make it that much harder. But I think part of the problem is there's a lot of misinformation out there on what you have to do and how hard it is to do it. The benefits of physical activity for your mental health peak at a relatively low level. You don't have to do anything crazy to build this into your life. In terms of frequency, we're looking at 3 to 5 days a week tops. You can do more than that if you want, but it's not necessarily going to provide additional benefit for your mental health. Intensity appears to top out at around moderate, meaning you're able to have a conversation while you're doing your workout. You might feel a light skin sweat, but you're not drenched in sweat. If you're doing more than that, you're overdoing it. And at least as far as your brain is concerned, there's really no reason to push yourself beyond that level. Duration varies a lot depending on the study you look at, but we're looking at somewhere between 15 to 45 minutes a day. And my favorite part, the format, meaning what you do for your physical activity, your brain doesn't care. It doesn't make a difference. So if there's some trendy new form of exercise that you cannot stand, have no interest in, don't do that one. Just do what you like. I don't actually like to move my body a whole lot, ironically, so I do weight training because you don't have to move that much when you do weight training. I think CrossFit looks super cool, but I'm way too much of a wimp to do it. I'm not into running. I'm not a swimmer. I just like to lift heavy stuff. It's all just about finding something that works for you and finding something you can stick with even on your lowest days so that physical activity can truly become a cornerstone of your mental health recovery, as it has for me.